Today I wanted to talk to my patients about some issues with testosterone levels for males. There is a lot of people aren't aware, but over the last 3 to 5 years, there's been a decreasing level of free testosterone in male patients in the industrialized world around the world happening. We don't really know why, all right? And we're going to give a couple suggestions why, but there's a tremendous amount of military significance to this. What's happened is that about 4 years ago in Denmark, where they have socialized medicine, they did a study where they took all the 25 or 21-year-old males and measured their free testosterone, and all the 55-year-old males and measured their free testosterone. And lo and behold, when this was published, the average 21-year-old male has a lower free testosterone level than the average 55-year-old male in Denmark. This is, oh my gosh, this has sent shockwaves around the industrialized world where this is happening. Because of why? And there's tremendous military significance. So military is putting big bucks to figure out why. We don't know really why, but we're going to talk about 3 things that we conjecture and believe have an effect. Number 1 is obesity, all right? And this goes back to gut biome and dietary issues and that in your food, but obesity, we know, has a direct relationship with testosterone levels. Number 2 is that we know and for males, even young males, the fatter you are, the less testosterone you have. And the issue is the testosterone level is decreased because of the obesity. And then why are you obese kind of thing. The second issue that we found that people believe, and these are conjectures, the jury is not out on this, but these are what the recommendations we give to patients. When your testosterone level is lower, as we age, it comes down normally. We're not talking about that, but people who have a normal level of testosterone for what their age, what it should be. These patients, 2 other things we ask them to do. Number 1 is we ask them to stop all plastics in contact with foods and drinks. Most people know that the BTBD plastics were known to cause problems with increased estrogenic compounds, gassing into the liquids, and causing lower levels of testosterone. So they outlawed all that. And they started newer plastics. Well, the bottom line is the newer studies are suggesting that the newer plastics are just as bad or maybe worse than the BPD plastics. So the first thing we ask is all plastics in contact with food or drinks should be left out of, should be avoided, all right? That's easier said than done, because in our economy of the way we eat, you can't drink a soda, you can't drink a glass of bottle of water, because they're in contact with plastics, all right? Number 2, the newer studies are suggesting it really we changed the plastic forms, all right? So we get rid of this problem, but the newer studies are suggesting it has not solved it at all. So we in general say, listen, if you have this issue, we'll tell our male patients, no plastics in contact with foods or drinks. Let me give you some little real tips. A lot of people believe that one of the biggest offenders or when you go to your local fast food place or McDonald's or whatever. It's not only McDonald's, but you have a cup of coffee or buy it from Starbucks or wherever you buy your cup of coffee. It'll be in a little container, all right, that's not plastic, that's okay, but it has a plastic lid on top. We find that with that, what they found with those plastic lids is that hot fumes from that hot coffee tends to gas off these estrogenic compounds and mix them into the coffee. That's the belief, all right? Now, again, this is not proven at this point that that's the cause. But we ask, bottom line, that the help with the weight. Number 2, stop all plastics in contact with foods or drinks. The third thing we do is we ask people to stop all soy products, all right? We've known for years, in fact, many of the medicines or the over-the-counter medicines that women use for their issues with menopausal symptoms, you can buy over-the-counter, are made from soy products because the soy product issues can turn into analogous type of issues close to the estrogenic compounds. Now, the feeling, the GMO soy products are felt to be worse for this. And probably 85–90% of all soy today in this country is GMO soy. This next thing is that soy is in everything, many prepared foods. Most prepared foods have a soy component in them. So you have to read labels. And essentially it means you have to eat more scratch cooking, all right? Less prepared foods and things you buy from the store in a box or things like that. Because most of those have a soy component in them. So those three areas, avoiding keeping your weight down for a male. Number two, avoiding plastics. We say all plastics in contact with food or drinks. And that's easier said than done, all right? And number three, avoiding soy products in prepared foods are where we start with that, all right? There's other blood work things we do, and there's a few other things that we will do often for these patients. We'll give them our very good multivitamins so that there's zinc deficiency or manganese and other deficiencies that can affect this. We don't have to worry about those kind of things. But those three things are basic to our patients with low testosterone or a lower testosterone than you should have for their age, all right? And that's just a little bit of correlation of why we recommend these things for our, especially our young males that have low testosterone levels. It's really amazing. I saw the other day, last week, I saw a patient who is 19 who has a free testosterone level lower than somebody who's 60. To me, that is such a shame, all right? That's just terrible what's happening there. And we went over all these things for him, and plus a few other things. But this is just something to keep in mind. As we say, the more natural food you use, the less prepared food, probably the better you are off health-wise. Thanks a lot for belonging to the practice.